So women consider breast augmentation surgery for many different reasons, whether it's body proportion, aging, or simply wanting to look better in a swimsuit. There are different options to choose from.
Today we welcome Dr. Miguel Yanez and Dr. Gregory Mantooth from Piedmont Plastic Surgery and Dermatology. Welcome, doctors. Good to have you here.
Thank you very much.
Thank you for having us.
We mentioned a lot of reasons why women may want to get breast implants. What seems to be the most common reasons?
Well, women are interested in breast augmentation for a number of different reasons. Some women are just born with naturally smaller breasts. A lot of patients that we see have lost breast volume due to pregnancy and subsequent breastfeeding, or some women just lose breast volume from weight loss. But all of our patients have in common that they're looking to improve their body proportions. Like you mentioned, that's really the goal of the surgery, is to establish harmony between the breast, the waist, and the hips and create an overall more aesthetic appearance.
Dr. Yanez, what type of implants are available?
There are basically two types of implants. There are saline-filled implants and there are gel-filled implants. On the outside, they tend to be the same. The gel implants are the ones that are mostly used now. There are implants that have a form-stable shape. I brought one here that you can see, so they're teardrop shaped. And
that makes them look more natural, right? The teardrop shape?
That's one of the presumptions. I think one of the best things that we have is that when you come to the office, we have a 3D imaging system where we can try the different types of implants on an image and simulate what the augmentation is going to look like. So these work better on some patients, those that want a more natural look, whereas the round ones, which are the previous generation implants, these give you a more augmented look. And some people want that. So those are the basic type of implants that we have.
Okay. Right. How are they placed in the body? Can you talk about that? I know you do it under the muscle, correct, to make it look more natural?
More common, yes, that's the most common approach. We're going to place the implants through basically 3 different types of incisions. The most common is in the fold of the breast, but some women prefer to have the incision in the armpit or just right around the areola. But more often than not, we're going to place the implant under the muscle, which is going to help provide a more natural shape and feel to the breast.
Okay, Dr. Yanez, can we talk about downtime? For example, how long does the surgery take, and what about recovery?
The surgery takes about an hour to do if it's just a breast augmentation. And patients take about 4 to 5 days to feel better and well enough to go back to work. And usually the restrictions are minimal. We ask our patients not to bear large amounts of weight while they're recovering for several weeks. But other than that, the recovery is pretty smooth.
And you can't, no vigorous exercise, correct?
No vigorous exercising during that time. Motion is always good because most of the discomfort associated when you place these implants underneath the muscle is associated to muscle spasm. So if you move, you will feel better.
I may have researched this topic a time or two. Might be why I know a little something about it. What about scarring? I think a lot of women are concerned about scarring.
Well, all of the traditional locations of the scars tend to heal very, very well. They're all what we call very favorable locations for scars, meaning that there's not a lot of tension on those incisions, so they tend to heal very nicely. Plus today, there are a lot of things that we can do in terms of scar therapy. There are lots of topical aids that can be very beneficial. Lasers can sometimes be helpful, but just massage and sunscreen, we go over all of that with our patients to really try to minimize those scars.
But for women who have this surgery during their childbearing years, there has to be a concern about breastfeeding.
There usually isn't much. It's very, very rare for breastfeeding to be affected by this. There are 2 places where you can place the implant: under the gland or underneath the muscle. Most surgeons in the U.S. place them underneath the muscle, so you're really not touching the gland-bearing tissue. If you go around the areola, there is a slightly higher chance of nipple sensation loss and possibly difficulties breastfeeding, but still extremely rare.
So that can happen. Losing sensation can happen, but not necessarily.
It's very rare.
Right, very rare. So again, what about when it comes to mammograms? Do implants cause any, is there anything to be concerned about when it comes to getting a mammogram?
Well, I mean, that's a great question, and there have been a lot of studies that have been done on that topic, and consistently what's been shown is that having breast implants does not interfere with your ability to detect breast cancer. Now, when a woman has breast implants and goes to get a mammogram, she should let her mammographer know that she has breast implants, and they will do some additional views called Eklund views that basically allow maximum visualization of the breast tissue.
Okay.
Piedmont Plastic Surgery offers free consultations, so if you're interested, you should call. And by the way, they make it so easy for you. You can fill out all your paperwork ahead of time by filling it out online. Again, you fill out that health history online ahead of time. They have convenient online bill paying as well.
Piedmont Plastic Surgery and Dermatology's website is ppsd.com. That's ppsd.com. You can also call 704-542-2220. That's 704-542-2220.
And they're offering an $830 discount on breast augmentation through the end of May. So again, call now or go onto their website. I know this is a busy season for you right now.
Absolutely.
Sure is.
Good. Thank you so much for stopping by today.
Thank you for having me.
Thank you very much.
Appreciate it.